Hello guys, this is me Dr. Kashan Kasi. Today here we were discussing the ECG patterns. In previous lecture we have discussed the left and the right ventricular hypertrophy and the ECG pattern seen in both these conditions. Today we are going to discuss the atrial hypertrophy. In the atrial hypertrophy there will be the left atrial hypertrophy, there can also be right atrial hypertrophy. So the left atrial hypertrophy and the right atrial hypertrophy will be due to some other reasons like pulmonary hypertension, due to mitral stenosis, atrial stenosis, or some other causes of the cardiovascular system. So first of all we will discuss the left atrial hypertrophy. Left atrial hypertrophy is defined as the atrial hypertrophy or enlargement increased in the size of left atrium due to any cause which is causing the left atrium to work hard or against the workload. So whenever there is a left atrial hypertrophy, you will see some changes in the ECG. So basically we will discuss here the ECG changes today. So the first ECG change you will look whenever there is a left atrial hypertrophy is wide P wave. Wide P wave means the width of the ECG is greater than 0.12 second. This 0.12 second is actually showing greater than 2.5 small scale boxes. We have discussed the small and large scale boxes in the previous lectures. So whenever it is greater than 2.5 small scale boxes of the ECG, this means the ECG is showing wide P wave, and the wide P wave can be notched or bifid. Notched or bifid is the pattern of the P wave seen in the ECG when it is like this. This is the notched or bifid P wave, and this is the abnormal condition of the P wave. This is not the normal condition. Normally the P wave will be in the positive reflection and it will be like this. So the P wave which is wide is usually notched or bifid, and it is seen in the leads lead 2, AVL and V1. These are the leads in which it will be seen in better condition. So whenever it is wide, we will call this P wave P mitral. So this P mitral is the terminology used whenever it is greater than 2.5 small scale boxes. So there is another condition which is biphasic P wave. This is seen in the V1 lead of the ECG, and this biphasic P wave means the positive first deflection of the P wave, and then there will be the negative deflection of the P wave. Then this QRX complex will be formed and so on. So this is the pattern of biphasic P wave. So this is the biphasic P wave seen in different abnormalities. So the causes for these abnormalities like P mitral or biphasic P wave is usually due to some other reasons like mitral stenosis, or there can be mitral regurgitation, and there can be secondary cause which is leading to this condition of left atrial hypertrophy. So we have discussed here the causes. We have discussed earlier the causes for the P mitral, and we have also discussed the left atrial enlargement and the ECG changes seen in the left atrial hypertrophy. Now we are going to discuss here the right atrial hypertrophy. Like the left atrial hypertrophy, right atrial hypertrophy when occurs, there is also the enlargement and increase in the size of right atrium of the heart, which may be due to some reasons, the causes for which involves the pulmonary hypertension. There can be tricuspid regurgitation, tricuspid stenosis, or other conditions. So the right atrial hypertrophy has its own causes like the left atrial hypertrophy. So whenever there is a right atrial hypertrophy, you will look at the ECG, there will be the changes also seen in the P wave. So these changes will be like this, which is P pulmonale when P wave is greater than 2.5 millimeter height. 2.5 millimeter means it is greater than 2.5 small scale boxes, and whenever it is greater than this 2.5, this means there is an abnormality. Now this abnormality is called P pulmonale, and it is better seen in lead 2, 3, AVF, and also sometimes in V1. Likewise, we will also see the biphasic P wave. We have discussed here the P wave which is biphasic in nature. Here there will be also biphasic P wave, but usually in the right atrial hypertrophy there is only a positive deflection, tall deflection of the P wave seen, and this biphasic is not usually seen, but sometimes it can also happen and there will be biphasic P wave seen in the V1 lead of the ECG. So these are the abnormalities of the right atrial hypertrophy. We have discussed now the left atrial hypertrophy, right atrial hypertrophy. We have discussed the differences of both these, in which we have seen the differences in the ECG patterns. But after all this discussion, we cannot be conclusive on the left atrial and the right atrial hypertrophy by looking only on the ECG. There are other tests to confirm the diagnosis. We call this test the echocardiography of the heart. The echocardiography will be diagnosing the left and right atrial hypertrophy. So for the diagnosis, we will also go for the echocardiography of the heart. So today we have discussed the left and the right atrial hypertrophy. There are the differences. We have discussed these differences, and we have also seen the ECG patterns of the left and the right atrial hypertrophy. In the next video, we will be discussing some other ECG patterns of other cardiac conditions. Hope you like my video. Thank you very much for watching. I'll see you in my next video.